At the time of this recording, it is November 9th, 2025, and we are in the midst of a government shutdown, the longest government shutdown in history. I believe this is day number 40. SNAP benefits have been denied for over 43 billion people. TSA workers are not showing up to work. The same with air traffic controllers. They have actually shut down some of the airline operations simply because of this shutdown. As a nurse, you are not immune to what is going on. One of the big reasons for this shutdown right now is that they are actually fighting for health care and upcoming health care cuts to both Medicaid and Medicare. If you have not experienced any issues yet here in 2025, you are going to experience some here in the near future. I'm here to help nurses prepare for the future and what's to come. There is a lot that will be changing in the course of a few months, in a few years, and it's going to change the trajectory of American healthcare for probably a lifetime. So what I'm talking about today is you as a nurse getting prepared for the changes ahead and you getting a head start on those changes that need to be done. As I mentioned earlier, even if you don't get SNAP benefits, you're not on Medicaid, you're not on Medicare, I'm sure you know somebody who is. In addition to your jobs will be affected whether or not you work in a rural hospital, an urban hospital, a clinic, a small town, a large city, because things are already happening as far as layoffs are concerned and the way that healthcare is going to be delivered. I want you to stay with me now. I'm not just trying to scare you with fear-mongering or anything else like that. I'm trying to let you know what I'm actually seeing as someone who's been a nurse for 24 years now and going into one of the worst times in history for healthcare, in my opinion, okay? So we all know what happened in 2020. 2020 was bad enough, but here we are again in 2025, going into 2026 with something that people have not even imagined was possible, because 2020 was bad, and I think it's going to get much worse. So stay with me here because I'm trying to actually help nurses understand how they can brace themselves for these upcoming changes to healthcare and the economy. So let me connect the dots for you. The government shutdown, it affects everybody. And this is not just a political game. I don't care if you're Democrat, Republican, Independent, or you don't vote. This is going to affect you in healthcare and in your actual nursing career that you've worked so hard for. So let's talk about the trickle-down effect. When SNAP benefits get cut for billions of people, when Medicare and Medicaid costs get cut or eliminated for millions of people, how is this actually going to hurt the nursing profession? Number one, we're going to see more hospitals and more clinics closing. It happened in 2020, and I believe it's going to happen more so in this next coming year, simply because those hospitals, those clinics are not going to have the federal backed funding that they had previously. So imagine, number one, these patients aren't coming in for treatment. Okay, so that's already bad enough because that means people's lives are in danger. Number two, if these people aren't coming in for treatment, therefore the revenue is down. And you're saying, well, they didn't really pay for anything in the first place because they were on Medicare or Medicaid. But the truth is that all of those programs are federally backed and the federal government was paying for that. So now if these major hospitals, these rural hospitals, these urban hospitals, even in big cities, aren't getting their federal funding from patients who previously had that funding in their insurance, what do you think that means? That means the hospitals aren't getting paid. They're not having the revenue numbers that they had. So they are going to start cutting back. They are going to start reducing staff. They are going to start laying off more healthcare staff, more nurses, more CNAs, more nurse practitioners, whoever it may be, because those patients are not coming through the door anymore. In addition to that, it's horrible for the patients considering the fact that their access to care has now been cut off. So what happens when people don't have adequate access to care? And I really hate to say what happens because you and I both know what happens when people don't have good access to care. They get worse. Their mortality and morbidity gets worse. They start to not care. They unfortunately start to die. With you as a nurse who had a job and had your paycheck every 2 weeks and had your stability, what's going to happen when the layoffs start happening? What's going to happen when you try to find another job and there is a ripple effect across the nation where you can't find another job because they're just not hiring because there aren't enough people coming in for services? So what I'm getting at basically is that as nurses, we need to prepare. If you have a job right now, that is great. I want you to keep that job. I don't want you to run out and quit and do something crazy. I want you to keep the job. But what I want you to do in addition to having that job is creating something else for yourself and your family on the side. Now, I'm not here to scare you, okay? In all honesty, even though I'm a bit anxious about what the future may hold, considering the fact that we're in the middle of the shutdown and the fight is basically between food and healthcare, two things that people need. So I'm not trying to scare you. Basically, what I'm trying to do is prepare you for the future. I have been in business. I've been in nursing business since 2013 when I founded Renursing EDU. Way back then, I had the thought process of doing something outside of my nursing job in order to make extra income for when the time came that I either wanted to leave the profession and do something completely different, or in times like this where your job and the healthcare system is really not stable, okay? So like I said earlier, the stuff happened in 2020 with layoffs and things like that, and a lot of people did not expect that. I did not expect that. I was furloughed in 2020 and it has not gotten much better, but now, right now, at the end of 2025, going into 26, I think it's going to get much worse, okay? And so I think we're gonna see what we saw in 2020, but maybe on a bigger scale. So I want to actually prepare you, and I want you, whenever you see this video, I want you to start thinking about what you can do to prepare yourself before January 2026 and start now, okay? I'm going to go through some things. I have a PowerPoint slideshow to show you, and I'm gonna go through some things about how you can prepare yourself for the inevitable, right? So maybe if you get laid off, or maybe if your hours get cut, or maybe if you get furloughed. As I said earlier, this is not just about the federal workers that aren't working right now, that haven't had a check for 40 days. This is going to affect everybody, and this is really going to affect healthcare and nurses. So let's go into my slideshow that I have so I can show you how this all works and how you can prepare yourself for what's coming. You don't have to quit nursing. You don't have to abandon your patients. You don't have to take a lot of time out of your busy schedule, which I know it is busy as a nurse, to do this, but you need to prepare. So without further ado, let's go ahead and get into this presentation, and I'm going to go over everything and show you how to actually prepare for what's coming in the future. All right, so let's go ahead and talk about that healthcare crisis that no one is talking about right now, but what is about to go down in 2026 and beyond. Actually, it's already started, as I mentioned in the introduction, but let's just go ahead and talk about the whole picture. So in July 2025, the One Big Beautiful Act passed and it was signed into law. So I didn't really pay too much attention to it, I will admit. I did not pay too much attention to it. But then I started doing more research and realized that this is going to be damaging for millions of Americans that are directly on Medicare, Medicaid, and SNAP, and for the rest of the country indirectly as far as the healthcare industry overall. So this is going to affect all Americans, whether you believe it or not. So this perfect storm is here and it's going to change everything for healthcare. Okay. So if this shutdown that we are in, we are having a shutdown and it's based upon SNAP benefits and extending those subsidies for the Affordable Care Act. And either way, people are losing. Either way, we are losing money and inflation's going up. Everything is going up. Jobs are being cut. But the big thing is I'm worried about if people don't have access to healthcare anymore, if the subsidies go away and healthcare doubles and triples in prices and people cannot afford healthcare. Number one, like I said earlier, people are going to end up losing lives because of this. And then number two, the nurses, if people are not able to afford healthcare and the hospitals aren't getting those federal subsidies, they are going to start laying people off. If people are sick but they're not coming in because they don't have any health care, they can't afford it, whatever, they are not going to come in. Hospitals are going to start laying people off. They are not going to their federal funded money anymore from these Medicare, Medicaid cuts, and then therefore they are laying off the healthcare staff, right? So let's get into why I need you to prepare and I need you to pay attention to what is going on now, okay? I mentioned all of this earlier. Everything is happening, all the cuts, Americans losing coverage. Regardless if you're on the ACA Act, Medicare, or Medicaid, anyways, you still are going to be affected if you have private insurance because the private insurances are going to go up too. So it's going to come down to people being able to pay for their medical care or people being able to survive with their everyday living expenses. So we know that more than likely people are probably just going to cut that $2,000 bill a month and go without health insurance. And that's going to be a whole another can of worms that is opened up. Okay. I mentioned that hospitals are going to start to close, the rural hospitals for sure, those hospitals that are in lower income areas where they're getting a lot of Medicaid, Medicare, and also the urban hospitals that are not in rural areas, they will start seeing cuts as well because they also get federally backed money and they're not going to be able to get that. Okay. So we know that as a nurse, things can be stressful. I have talked to nurses since 2013, a long time ago when I wrote my first book about doing other things besides nursing because people came up to me all the time in the unit and were always asking me things that they could do besides nursing or outside of their job. So nurses are stressed out. Nurses are burned out. They're stressed out. They're overworked, they're underpaid, and this is not going to get any better come 2026. We already know that, okay? But what is not happening is that a lot of people really aren't aware. And I will say, like I said, when this law first went into effect and passed in July, I didn't read much up on it as I should. But now that things are starting to happen, now that we are going into the 40th day of a government shutdown, things are getting real here. And as a nurse practitioner, I'm even changing up some ways of, as far as what I will be doing in healthcare and how I will approach this, knowing that there's going to be so many people that are going to be affected by this. So for the average nurse that is just working in the hospital, working in the clinic, and you're unaware, this is just to prepare you and to help you bridge the gap, per se. Okay. So basically, I said, all that's going to happen as far as the hospital shutting down, they're not getting reimbursements, people, losing their lives. So in nurses, we always thought that we had a steady job and we would always be in demand. And for the most part of my 24-year career, that has been true. In 2020, I was actually furloughed. I know a lot of nurses were either furloughed or laid off from their jobs in 2020. Since then, it's gotten a little bit better, but now coming into 2026, I think things are going to get a lot worse. I think we are going to see some of the stuff we saw in 2020 happening on a larger scale over a longer period of time. So I want you to prepare. Okay. Okay. So there is something that you can do. Keeping your job, obviously, that's important. Number one, make sure if you got a job, you keep it. You don't do any weird things now in between the meantime, but just be prepared. Just know that there may be changes coming. Okay. So I have been creating digital products since 2013 for a very long time. My very first digital product was an ebook, and I have been making passive income from my digital products up until now. Okay. And I know a lot of nurses do not have another source of income, or their other source of income is actually probably another nursing job. Because when I was an RN, I did work 2 to 3 jobs. I had a part-time job, PRN job, and I had my full-time job. So I know that a lot of nurses do that, and there's nothing wrong with that. But if your employer is going to let you go, if they're going to furlough you, if, whatever, push come to shove, something happens where you can't get to that job, that you have something else that you've built on the side that is actually helping you and coming in. Okay. And so that's what I want. So for nurses, this has been the easiest thing for me as far as creating passive income was with the digital products. And I believe that other nurses can start and create digital products and start making a passive income while they're working their nursing job and just putting that money away, growing that money, whatever it may be, if they want to start doing other things. So that way you have options if things were to go down as bad as I'm expecting things to go down. Okay. So there are already a lot of entrepreneurial nurses, and these are just some of the things that they are doing. They are creating online courses, digital products, coaching, consulting, telehealth services, other types of healthcare businesses. I have pretty much had my hand in all of this, except for the generalized just healthcare business per se. So like I mentioned earlier, the easiest thing to get started as a nurse, that's not going to take a lot of your time, that's not going to take a lot of money, is creating a digital product or digital products to sell, and then moving on to online courses. And then after that, growing into like coaching, consulting. If you're a nurse practitioner, you can have a telehealth service, healthcare businesses, opening up an agency, whatever it may be. Okay. I just want you guys to start thinking and start preparing. Okay. So starting where you are, digital products, this can be anything. So my first book was about starting a business as a nurse and starting whatever business you want. That's a big old typo there, but ignore that. So you can create whatever type of digital product you want. You don't have to do ebooks like me. So I have a good majority of my ebooks on Amazon that I've generated a lot of money from. They do take a little bit of time if you wanted to write an ebook, though. I do want to let you know. It has gotten easier with AI, but you still have to have that human element, and it's still going to take some time. Okay. So you can put together a guide. You can, do this in Canva. You can do this in Google Docs. It's very easy for you to do. You can do this in a couple of days. And then you have to figure out how to package it up and then send it on to the person who purchases it. So, what you can create. So, study guides and NCLEX prep materials. So, Renursing EDU, I have done that. I create study guides and things for nurse practitioner students to help them when they are in school and beyond. Also, the NCLEX prep, I have actual materials to help nurse practitioners with their boards. Clinical templates and documentation tools. I do have products as far as clinical cheat sheets for nurse practitioners. So that's another idea. Patient education materials, nursing procedure checklists, wellness guides. So these are all nursing related, but like I said, it does not have to be nursing related. Do this outside of your nursing job. If this needs to be an outlet for you and do something completely different, do that. If you have hobbies, if you're like the best gardener in the world and you know how to grow the biggest tomatoes, then make a guide on how to actually grow tomato plants or whatever it may be, okay? So this works because it's a low startup cost. So I have 0 to 5,100, that's a typo. So it should be 0 to 100 for digital products, simply because you'll need somewhere to actually create the product. So that can be free on Canva. But you'll also need a way to actually deliver the product, and you'll just need a couple things. So I'm estimating no more than 100. If you are to write an ebook, that will take probably close to 100, simply because you need formatting, you need your book cover, you need somebody to edit it. So that's probably on the higher end of this. But if you're just doing a simple guide, you can actually do this fairly cheaply. Okay. So the thing about it is you create this once and you sell it forever. So my books from 2013, 2014, those early books, they're still selling. My cheat sheets, my journal, my templates, they're all still selling. I created them once and they are selling indefinitely. You don't need any special license. You don't need any special skills. This works for any type of nurse. I was an LPN. Actually, I'm going to take that back. I was a CNA. I was an LPN, RN, and NP. So I know about nursing at all levels. So this works for all levels. I didn't start doing anything until I got my RN degree. But you can do this before you even get to that point, if that's where you're at right now. Okay, you can do this while you're still working full time. And in addition to that, you can start growing and doing other things after you get those digital product sales and that digital product done, and you can do other things to grow. Okay. So the next thing would probably be courses. So within Renursing EDU, I do have a few courses for business and other nursing related things that would help people start their business, right? So you have different course ideas. So if you're going to start with a digital product, I would say maybe do that digital product and then expand on it with the course. So that would be easy, considering the fact that you've already got the digital product, you've already got the little cheat sheet, the guide, whatever it may be, and then you can expand on it and giving more detail for people who want to learn more, and you can put that within a course. So the numbers is that the courses, actually, I didn't actually go over this with you with the digital products, right? So the digital products, you can start selling digital products anywhere between like $7 all the way up to like $97, just depending on what you're actually doing and if it's specialized and how it actually helps somebody with a transformation. Basically, that's what you want to do. You want to help give someone a transformation. So if I am a horrible gardener, which I started a garden last year and I got a couple tomatoes out, but then my tomato plants died. And you can actually show me how to get a harvest from my tomato plants year after year, so I don't have to go back to the grocery store and I have fresh, homemade, or homegrown tomatoes. I would pay you good money to learn how to figure that out. Versus maybe you are giving somebody a transformation on how to go from not knowing anything about gardening at all, like a completely total new beginner to someone who is like digging out their first flower bed or something. So there's a little bit of difference in the levels of how you're going to teach and who you're going to teach. Okay, just keep that in mind. But those courses can range pretty broadly. Like I have here 97 to 497, but that number is very broad because you can have really small courses that are like $27, $47. Actually, courses that I have right now are about 47-ish to 100-ish. But bigger courses that I have that I plan on, launching in the future are going to have a bigger price tag. And you can do that too. And especially the more specialized that course is and how in depth that course is on what you're trying to teach, you can also have a bigger price tag on it. Okay. So think about it. If you had 10 courses and you're selling them at $500 a pop, that's really good money. And in a lot of cases, if you're working part-time, that is going to replace your part-time income to where you only have to work, a few days a week in nursing, and your course business can take up the rest of the income, right? So there are different options there as what nurses can do. Okay. So like I said, I would start with a digital product and then I move on to a course. So this costs a little bit more as far as startup is concerned because you are going to have some things that you don't need for digital products. So with digital products, you don't need a website because you can just go to a marketplace and you can list your products there. You don't need a platform that is going to house like your videos. So that's called the LMS, a learning management system. But with courses, you need a place where you have your lessons, your modules, your videos, all of that good stuff in one place for your students to learn. So depending on what kind of software you use, that may have a price of either, $50 to $200 a month. If you're like me and you like lifetime deals, you can check out AppSumo to see if they have any like course creation software or website software and things like that, so you can actually create your course. So you will also need a website. So if your course platform does not also work as a website, you may actually need a website in addition to that. So there's just a couple more nuances when you're looking at creating a course. But either one of these can be done in between your shifts at the hospital or the clinic. So if you take a couple hours a day, you can get something done in a couple weeks as far as a course. And then the digital product, in all honesty, a digital product does not really take that long. The longest part of, creating either a digital product or a course is actually figuring out what you're going to do and outlining everything. So I said, you go ahead and build this stuff while you work. So like I said, like during the day, you're at your job, but you have in the back of your head that I need to do something different. And so you're going to go home and you're going to work on your digital product or your course. Okay. Okay. So here's the plan. January 2026 is coming up. We have 60 some odd days, I believe. We don't have that long until January 2026 is here, but things are just going to get worse after January 2026 for healthcare. So if you're watching this video now, after I release it, then you have time to get things done before January. So when January hits, you'll already have your first digital product, you already have your first course or whatever it may be, and you can start adding on, okay? So months 1 to 2. So this is from November to December. Basically, you're creating that first product, but it really should not take that long. And then after that, you are launching it. So you're putting it up for sale. You are telling people about it. You hopefully are making some sales. And then when we move into months 4 through 6, then we're trying to get obviously more sales. And then month 7 plus, you need to figure out what you want to do. Actually, probably a little bit sooner. You'll probably figure it out a little bit sooner if you need to add any more digital courses, digital products, or courses, or if you want to move on and do something different and add on like coaching, consulting, memberships, things like that. Okay. Okay. So the key points here is that you're not quitting your job, but we are preparing for what if. Okay. You are building options while you're still getting paid at your current job, And, you're not going to have any sweat roll off your back if your hospital decides to cut something like benefits, cut your hours, whatever it may be. And last but not least, if you're one of those nurses who are thinking about leaving nursing, period, once you build this up, you'll have the opportunity to do so if you're burned out. Okay. That's if you're burned out. Okay. So, what is coming? So, like I said, everything's happening January as far as these healthcare cuts. In 2027, I think that's when the changes go into effect for Medicare, I believe. But in January 2026, we're still going to see some issues because I believe healthcare premiums are probably going to be going up a lot come January. Okay, so yes, the Medicaid work requirements kick in. And then, so it's going to start January 2026, but it's still going to be going on January 2027. Okay, so just start now. This takes about 3 to 6 months to build momentum. And you guys are going to be forever grateful if you start right now. When I wrote my first book, my first digital product, it took me forever. But the more I started creating, the faster I could create things and the more momentum that I actually built up. Like I said, I've been doing this for over 10 years now. So it's just you need to get started. And I've talked to so many nurses. They're like, I don't know what to do. I don't know how to do this because I know nurses aren't necessarily technical people, but I am here to actually help you figure all this out so you can have a plan for what's going down here in 2026. Okay. So, what I was saying here is once you have created your digital products and once you have started making money from your digital products, what you can do is expand. So, adding in those group coaching programs, creating a membership. If you're a nurse practitioner like me, starting your own telehealth service, you can consult whatever type of consulting you want to do. So, basically, we have 3 steps here. Do the digital products now, then add in other services, other products, and then lastly, you figure out if you're going to go all in with your digital product business or if you eventually want to cut back on nursing hours if you have that option. So this way you actually have options. If you are a nurse and you only have one nursing job or any nursing job and you get laid off or furloughed, you have to think, where is extra money going to come in? Or if your insurance premiums double or triple or whatever, how am I going to afford this? Okay. And this right here is something that you can do on the side so you can start not having to worry about things. So, like when I was furloughed in 2020, I was really not stressed out simply because I have an extra income stream that comes in every month from my royalties. So every month I get paid and I was not stressed out considering the fact that I had extra income. Had I not had that extra income coming in from my ebooks, my digital products and everything, I would have been really stressed out. And I probably would have had issues knowing that I could not find another job, considering the fact that a majority of people were furloughing or laying off nurses. Okay, so I took a sabbatical at that time. I didn't do anything for a few years simply because I could. Okay, so let's talk about what we're doing next as far as what you need to be focusing on this week. Okay, I'm going to give you some action steps here. So your action steps are number 1. So list 10 questions that you repeatedly get asked by your coworkers. And I say this specifically because before I wrote my book in like 2011, 2012, people were always asking me about what they could do. What they could do besides nursing, what other job they could do, what business they could start. I got it all the time. And it was really weird because I didn't know why people were asking me because I worked on the unit with them. They didn't see that I had a business. I didn't even have a business. So I don't know why they were coming to me for business and career advice. So that's how I ended up writing my first book, and that's how Renursing EDU came to be. Okay. Step number 2 is choose one problem that you can solve with a simple download, course, whatever it may be. Let's talk about like a digital download that can eventually be turned into a course. Okay. So one problem. So at that time, my one problem was that nurses wanted options. And so I gave them a book that gave them options on types of businesses that they could start. Okay. Number 3 would be to create a basic outline. So I love my post-it notes. I always have post-it notes and sticky notes over here on my desk. And so I would suggest that's the same thing for you, whatever it may be, sticky note, napkin, whatever it is, start making notes on what you would cover within your digital product and, how you would actually set things up. Next would be pick a platform. Like I said, digital products does not have to be very expensive to start up. You can start for zero, like I said. So Google Docs, make a Google Docs form, template, whatever it may be, and you can make it all pretty and stuff in Canva, and then you can upload it to Gumroad and you can start selling. Okay. Next is obviously you need to start telling people about your stuff, because if you don't let anybody know that you have something available, no one is going to actually buy it because no one knows. So start talking to your friends at work, start talking to other people, communities and Facebook. That's how I got a big push when I started way back when. I used to be in groups in Facebook, and I used to tell people about my book or tell people about my clinical cheat sheets to help nursing students, NP students. So tell people what you're doing. Tell people what you've created. Remember, you don't have to be perfect. You don't need fancy equipment. You just have to start. Okay. If you start right now in November, December, before January hits, you will be well ahead of these people who are blindsided, not even realizing that their jobs are at risk. Okay. Okay. So, with that being said, this is the end of my presentation. I just wanted to come in here and let you guys know that there are options. If you need any help putting together your digital products or your courses, I'm going to drop down links down below of the business courses and resources I have with Renursing EDU to help you. Okay. I want to know if you guys are thinking about something, let me know. So, what are you thinking that you can create a digital product on, or maybe even a course? Have you thought about something like this while you're working your nursing job? Let me know down in the comments what you feel like you would work on, what you would actually do. And I would love if you like this video, please like it. Please subscribe to the Nurse Pivoter channel, and I will see you on the next video. Thank you.